thank you so much for letting me introduce Katie Albright, because she is just one of my very favorite people and a mentor in public policy and in making connections and partnerships. And you will know what a treasure it is to have her here. And I hope that this is just the first of many, many times that she will come and that we will collaborate together. Katie, if I may refer to her by her first name, is an attorney who graduated cum laude from Georgetown University Law School. And for the last 30 plus years, she has had an absolutely stellar trajectory, creating connections, advancing public policy, working with different systems, having an arc of expertise that goes from early childhood through adolescence in a family context and different systems of care. She was most recently appointed by Governor Gavin Newsom as chair of the first 5 California Commission of Children and Families, and by Mayor London Breed to the San Francisco Homelessness Oversight Commission. So that gives you a sense of her versatility in moving through different systems to bring them together. And early in her career, as yet another example of her versatility, she founded a nursery school in Nairobi, where she also taught. And from there, she went on to serve as San Francisco Deputy City Attorney, Director of the San Francisco Education Fund Policy, representing district public schools, and working to improve teacher qualifications and student retention. She was co-director of policy and outreach for Preschool California, where she advocated for statewide university preschool. And you know how transformational universal preschool would be. She's a policy advisor and has served as chair and member of multiple boards, including NARAL, Pro-Choice California, Planned Parenthood Golden Gate, the Aspen Institute, and the Joseph Corbell School of International Studies and Denver University. And here at UC Berkeley, she's a policy advisor at the School of Public Policy. Before her current position, she served for 16 years as a transformative CEO and president of Safe and Sound, a nonprofit community agency that protects and promotes the safety of children and families through direct service, education, collaboration, and advocacy. And last but not least, she is an inaugural fellow with Ascend at the Aspen Institute and received a prestigious social entrepreneurship SEER fellowship at Stanford University. So you can see how broad and deep her scope of expertise is, and I can't wait to hear from her and to start a long process of collaboration and partnership with her. Thank you.
Well, it's wonderful to be here, both saying hello to those who are virtually with us, as well as those who are in the room. So grateful to you. And Alicia, oh my goodness, I am overwhelmed by your friendship, your mentorship, your partnership through the years. We first knew each other, I think it was almost 2 decades ago. Alicia and Dr. Patricia Van Horn were working with Safe and Sound and many community organizations around how to provide mentorship and leadership through case consultation with and for children experiencing violence in their home and violence in the community. And through that, I have gotten to know many others at UCSF. In fact, Safe and Sound was founded by Dr. Moses Grossman, who was a leader and champion at SF General with respect to pediatric care. And Safe and Sound has had a long history and partnership with UCSF. So equally joyful, as well as to be here speaking with you about how do we think about collaboration and community partnerships to promote child and family well-being, really creating these community pathways for children. So I'm super, super excited. I came to this work, as Dr. Lieberman said, through the work of being a lawyer. My great learning early on in my career was to work for, represent a 26-year-old grandmother. And my second opportunity representation was with a 15-year-old girl who we were seeking what's called a judicial bypass in order to get an abortion because she had been raped by her mother's girlfriend, a boyfriend. And what these two individuals taught me so much was that the legal system was imprecise and had no ability to actually help families from the beginning in the way that these families needed the help. And it became very clear to me how important it was to create partnerships and look across all sectors to really, truly help families. So that's a little bit about me beyond the biography in terms of why this work is so important to me. Today, we'll be taking an exploration through how families and children have come to be treated in the United States, really looking at our child protection system, looking from a historical lens, an economic lens, really lifting up the voices of those with lived experience through community connections, and thinking about what some of our actions may be, both legislative and policy-wise, as we seek to change the trajectory for children and families and really promote a community pathway of prevention. The learning objectives align with the agenda, so hopefully you will walk away with at least one metric here. And here's a slide about disclosures, so you know that I don't have any conflicts. I have a great privilege and honor to work with many partners in this field and in this work. Here are several partners. And what I hope you see from this slide is a representation of county and state governments, of community organization, institutes of higher education, nonprofits, and those with lived experience. And as we go through this, in addition to thinking about these partners, I hope that you think about these guides. And I invite you to imagine a child or a family in your life, either from your own personal or your professional experience, and really have them as a guide as you listen to this information. What would you want for them in their lives in times of joy, in times of crisis? What if they were living in poverty, in violence? What if they were struggling with a mental health issue for themselves or a family member? What if they were the subject of a call to Child Protective Services? How would you want this child to experience this? How about their parent or caregiver? What if you were that parent or caregiver? How would you want to be treated? I know these may be difficult and triggering questions, so I urge you to please take care of yourself, take a breath, and really practice trauma-informed healing as you listen to this information. My guide is Jenny. She is a member of San Francisco's Family Advisory Board. This is a board that is lifted up and supported by UCSF. And Jenny permitted me to share with you this quote. It was a terrible time in my life, and I take responsibility for my bad decisions. Before all of this happened, I was trying to get mental health support. I had 2 kids under the age of 2 and severe postpartum depression and domestic violence in our family. My depression led to short-lived substance use disorder. I was 34 years old, and I had never used substances before. I was calling domestic violence agencies and couldn't get help until I had the title CPS behind me. Why couldn't somebody help me before CPS got involved? Jenny is not alone in her search for help before Child Protective Services removed her children from her home. Her story, sadly, is far too common and represents a systemic failure to support families. This presentation discusses a better way, a how-to guide to create a community pathway to prevention that holds safety as a priority and helps children and families stay strong together. In order to move forward, I think it's really important to see the past, and so I wanted to present a very brief historical framework for your information. Over the past 400 years, again, I'm going to be very brief in this, America has experienced a shifting paradigm in how we think about children and families, particularly those living in poverty. As you'll see from this brief history that I'll share, these following tensions exist. Is it the responsibility of parenting as an individual, or are we considering environmental conditions and where children live in families and communities and society? What is the role of government, and at what level, local, state, or federal? And what is the role of philanthropy and communities? Do we live in a system and are working in a system to rescue children from their families, or is it best to keep children with their families and strengthen families? These polarities exist and continue to, and so it really helps shape as we look at the history, but also as we think about the path forward. So in the 1600s, very briefly, this was marked by a period of enslavement and systemic separation of Black families through slavery and punitive approaches to discipline. We see this marking those who are poor, those living in our country, and those who are enslaved. And what the paradigm of this may look like is that we are focusing on parenting as separate and apart from the government. During this time, the care for children was often left to extended families. Fathers controlled these families, and children were viewed as small adults with economic and domestic responsibilities, including children being indentured to work for other families or left without protection and enslaved. As we move into the 1700s, many families are struggling in poverty with increased rise of urbanization and industrial revolution. Parents who are living in poverty are living in poorhouses or almshouses, and often with their children. And then as we get through the 100 years, children are forced into orphanages and apprenticeships and indentured servitude. Going into the 1800s, there's a period of enlightenment with enlightened thinkers that are beginning to understand that childhood is a distinct part of life. And this is the time when private charities are rising and focusing on children, creating private foster care. And the paradigm is shifting from families as individual units to one of rescuing children from their families. This is happening with increasing severity in poor white families, immigrants, Native American, and Black families through this time period. This quote is from a reformer during this period, William Pryor Letchworth, who spoke in 1874, and he talks about the fight of pauperism, poverty. The most famous quote of this time, and he says, if you want to break up pauperism, you must transplant the child. When the parent can't protect their child, can't feed it, can't clothe it, can't keep it away from evil influences or perhaps the degrading it by its own example, it's the duty of every man to step forward and save it. So we see the paradigm shifting and children are separated from their families during this time. Then 35 years later, there's some more Enlightenment thinking. We haven't gotten quite there, but President Roosevelt in 1909 is speaking at the White House Conference on the Care for Dependent Children. This was a landmark convening to really shape the momentum of the evolution of child welfare in our country. And he begins talking about home life is the highest and finest product of civilization. Children shouldn't be deprived of it except for urgent and compelling reasons. But he also creates this distinction of those who are fit and unfit, what's a suitable family and not a suitable family. So again, we continue to see that Black, Indigenous, immigrant families are excluded from the benefits of the system. As we move from the 1909s to the 1940s, we're seeing an increasing dependence on for families. The needs of children and families are increasing through World War I and the Great Depression. We see the legislation of the New Deal. And again, we continue to see families of color excluded from the system. In the 1960s is when we begin seeing a little bit more inclusion with the civil rights movement. This is also the time when Dr. Kemp is writing the battered child syndrome. And for the first time, we are recognizing through x-rays that there is the evidence of child abuse. And this creates a significant momentum across the entire country, and the development of mandated reporter laws and a system that we all know because we're mandated reporters of calling up Child Protective Hotline, having them do an investigation and determining whether or not a child is safe to be in the home. This is also, as we get into the 70s, the rise of our current child welfare system, the adoption of the Child Abuse and Prevention Treatment Act, CAPTA, you may know it as, the Indian Child Welfare Act, ICWA, as well as these other legislations that are really promoting foster care and increasing the ability for family adoption, increasing the ability to terminate parental rights. And what we're seeing in this latter half of the 20th century from 1970 to 1998 is a doubling of the number of kids in foster care, from 300,000 almost to 600,000 children in foster care, and a significant disproportionality of those children of color who are in the foster care system, disparate from the population. In the 2000s, we begin to see the evidence of thank you to all the researchers in this room, researchers of brain development, and really understanding what the impact of trauma is on the developing brain. The ACEs study started in the 1990s, but we're beginning to see its impact around trauma. Dr. Folletti came to San Francisco, we know that, and really impacted so many of us. I highlight this because this is the time period where I'm sure many of you are all working in, and you don't realize it's a paradigm shift because you're in the middle of it. But this is a big deal that all of this is happening, this focus on prevention and early intervention. And you have this landmark legislation in 2018, the Families First Prevention Services Act, which for the first time moves from the hotline to the helpline. It moves federal funding more upstream. We're going to be talking about that. But it truly shifts the paradigm. The CDC in 2016, right before this legislation is taking place, recognizes that child abuse is actually preventable. You can actually help families. You can support, and that children and the impact around child abuse and neglect is caused by environmental factors. And that there's this necessary knitting together this multi-system approach of public health, government, social services, and justice. Dr. Lieberman, you will recognize your words because you said in 2017, and I am so moved by this, you understand that children need to be with their families. Raising a whole child means trying to understand the emotional meaning of their behavior, rejoicing in their joys, protecting them when their fears, helping them learn what is okay and not okay to do, and reminding them that there is another side as they learn to be whole adults. This is the job that lasts a lifetime and that we're all striving to do. In that sense, young children are wonderful teachers and companions as we practice doing with them what we ourselves need to do to become whole. Thank you. And this is the paradigm we're in. You probably recognize this. This is the ecological model, but children are situated within this in government and community and society systems. Jerry Milner, who is the director of the Children's Bureau at the Administration for Children and Families at this time, talks about child welfare needs to move to primary prevention of maltreatment and the unnecessary removal of children from their family. And what is remarkable about this is it's not just words that are happening, but we're actually beginning to see shifts of funding. And so Families First Prevention Services Act has a provision in it which says that the federal government should give an increased amount of money, allow states that opt into this prevention component of Families First Prevention Services Act to draw down more money to support prevention. And so we see, and it needs to go more than this, but before this is passed, $8 per child is spent at the federal level on prevention. And several years later, I think it's a 4-time increase, $34 per child. It's not enough, but it is moving in the right direction. So I wanted to share with you some, as we talk about dollars, some more economic considerations as we think about child maltreatment and bring you into California. This is work that Safe and Sound did alongside Berkeley's California Child Welfare Indicators Project, Chapin Hall at University of Chicago, and Haas School of Business at Berkeley. Really in 2017, we began looking at what the cost of child abuse is around our entire country, and we wanted to localize it. We wanted to think about what it was in San Francisco, around the Bay Area, and then all counties of California. And so we created an economic analysis, and I'll share with you some of that data. So in California, every minute there's a report to Child Protective Services. In fact, there are nearly 440,000 reports that were made in 2023 by mandated reporters to our child welfare partners. The majority of reports in California, in every jurisdiction in California, and I will tell you in almost every jurisdiction in the United States, the vast majority of what's reported is general neglect. And then you see here also physical abuse, both to the individual and to the sibling, emotional abuse, sexual abuse. So you might want to think about that child that you have in your mind's eye or the work that you do and see if that resonates in what you're seeing. And keep these numbers in mind because we will come back to them again. Of the 444,000 cases that are reported, 11% of those allegations are substantiated by Child Protective Services in 2023. We'll come back to that number. And we know that of those children I just spoke about, the impact on child abuse and neglect is significant. Children are more likely to have educational challenges, are more likely to be arrested or lead risky lives as they grow up, to have higher healthcare costs, and more likely to be unemployed. The impact to society and community is equal. Increase of homelessness, drug and alcohol dependency, incarceration, a decrease in workforce vitality, and a strain on community and government resources. So all these add up to dollars, and this is what the work that Safe and Sound, working with all those partners, developed this model that in 2023, we calculated that cost is $16.5 billion over the course of a child's lifetime for all those individual children with a substantiated case in 2023. Now that's like a huge number. I can't get my head around it. So I can tell you that we, with that same amount of money, would be able to send every 3- and 4-year-old to preschool in California, and we would still have money to send many of them to college. So child maltreatment costs, but research shows that prevention pays. Significant studies have been done to show the return on investment for family resource centers, home visiting programs, parenting education. This investment protects children and provides long-term economic benefits before you even begin to enter into the child welfare system. And it's not just at the system level, at the individual level. Research says that when you increase economic supports to families, like SNAP and WIC programs, increase minimum wage, you decrease stress on families and you decrease the number of reports to Child Protective Services. And the same is true in the converse. When you decrease economic supports, you're seeing an increase, research says, in child welfare involvement, even gas prices. If there's one number for you to remember today, this is sort of, for me, my most profound one. Oops, sorry. For every $1 increase in minimum wage, research shows we are seeing a 10% decrease in reports to child services for neglect. If we were to increase prevention programs by $1,000 across the board, we're seeing significant, these numbers translate to 4 to 7% decrease in the number of children that are within the child welfare system at every step along the way. So we know that prevention works, and the research suggests that prevention works. I want to share with you some quotes about when the impact is to caregivers. And again, a lot of this comes from the work that UCSF has done with its Family Advisory Board. This is a mother in San Francisco. I have my social worker from the Family Resource Center. They call me. This helps me because I speak with them. They ask me how my daughter is doing and what she needs and what do I need. My priority is my daughter, and they ask about her, if she needs anything, and I can tell them if I need anything for her. Quickly, they see that they can help. Like food, I call the social worker, I say, I need this, and she says, okay, and someone will come and help. San Francisco is really lucky. We have an incredible network of family resource centers. This is a new alliance, the Family Services Alliance, that is really family strengthening organizations throughout San Francisco. And you probably recognize many on this list that you work with. I know Good Sam, Edgewood, Safe and Sound, others probably are very connected with the services at UCSF. So child abuse costs, prevention pays, prevention works. But honestly, the current system isn't really designed to promote prevention. We haven't caught up with the changes in funding. And so we also experience caregivers struggling with the system itself. The problem is when you go to an appointment or they say, or they send you someplace with a letter, and the people there say, what is this? What did you bring? And then you're lost. You say, okay, the doctor gave it to me, but the people you're going to on the other side, they don't understand. And so you have to wait for another year until your child is in first grade and you see if maybe they can help. And then later you realize that there are other kids much younger than him who have been getting help since they were 2 years old. A Southern California parent talks about, why would I go and ask for help when I'm struggling? If it means that I might be questioned as a parent and have my kids taken away from me, I'd rather figure it out on my own than put my family through that. Shelly Lopez is a survivor. She lives in Napa. She is an incredible leader and advocate in this space, and she shared with me this story that and gave me permission to share with you. She says, my daughter was born medically fragile. I had no support from my family. I didn't know where to go for help. I didn't know how to ask for help because I didn't know what I needed. The domestic violence in our home got worse because of the stress of being parents of a child with significant needs. When the family called CPS, I had no idea that my child could be removed because I was a victim of domestic violence. How could they take her away from me? I believe my experience and that of my daughter's life would have been very different if we had support. If somebody had explained the failure to protect laws. Even though my daughter was in foster care for less than a year, she continues to suffer from the experience. And the system's also not working for mandated reporters. These are quotes from a focus group in Los Angeles that Evidence Change held, really trying to think about how do we change the system? What does that look like? And one mandated reporter said, if humanity gets lost sometimes and we report more out of fear, this is how we've gotten to, why can't we get to this place of how can we help the family best? It's more like fear mongering. We wish we were in a more supportive role than being a reporting role. Another mandated reporter said, a lot of what we see is about poverty, lack of resources, education. Not everyone should be directed to, and this is DCFS, it's the Department of Children and Families Services in Los Angeles, which can be traumatic for everyone. Maybe if there were a better hub of resources, instead of having to go through the child welfare system to get resources, that would be helpful. And finally, another mandated reporter says, if we had a clear list of what's reportable and what's not, it would allow us to be better guides for ourselves or even understand the criteria. There's sort of confusion in the field, right? And so the system's not working for families, not working for mandated reporters, and as you'll see, the research suggests not working for the system itself. So I want to bring you more to the present and talk about legislative and policy actions that are happening right now in California. So we talked a little bit at the beginning of the presentation about the legislative enactment of the Families First Prevention Services Act that happened in 2018. This allowed all states, if they wanted to opt into this, to have the benefit of funding for prevention. And California, along with many other states, submitted their plans. California did that in November of 2021. And then in January of 2023, the legislature adopted legislation to change the definition of, or change the definition of general neglect in our Child Abuse and Neglect Reporting Act. I'm going to ask a question, how many have heard about this? But let me tell you, the definition of general neglect for the purposes of reporting is only when there's a substantial risk of suffering serious physical harm or illness, and it excludes economic disadvantage of parents. So it specifically excludes poverty. When you see poverty as a mandated reporter, that is not a reason to report. Other reasons to report are safety and all the other reasons that you report now, but not for economic disadvantage of a parent. I'm just curious, those in the room by show of hands, how many know about this? For those virtually with us, it was a very, very small percentage. And that's not surprising. I've been in rooms across the state, and this law, even though it went into effect in January of 2023, people don't know about it. And so one of the actions that we're taking is really to begin training and educating, and I'll share more about it if you want to learn more about this law. Later that year in 2023, the California Child Welfare Council launches this wonderful mandated supporting community supporting task force. I'll spend more time talking about it, really developing recommendations about how do we think about the development of these pathways and make reform in mandated reporting. Los Angeles is doing some incredible work that I'll share, and there's more work to be done, which I'll go into about developing community pathways. So this is an excerpt from the slides from the mandated reporting to community supporting task force. They developed these recommendations, were just approved by the Child Welfare Council in California just in September. So they are hot off the presses, and we are working to enact them. I think that what's really important in the development of these recommendations, the task force is pulled together, and it was one of the most diverse task forces that I've been a part of. Really thinking about how do we support those with lived experience? How do we support mandated reporter experience? You can see the composition in the slide of those who are members of the task force. And then the subcommittees, there were several, and 6 subcommittees with many other members. And that was equally diverse in terms of its representation. Secretary Mark Ghali, former Secretary of Health and Human Services, Mark Ghali, said that this was a roadmap and an example of how to do policy work going forward. And so they, as a first step, looked at substantial data. And so I wanted to bring back some of this information to you that we talked about earlier in the session. I talked about the fact that 45% of all of the allegations of child abuse are around general neglect in California. It's really become this catch-all. It's often driven by racism and bias and the absence of economic opportunities and resources. And significant research has been done to also share that in this 45% group, many of the families that are reported have co-occurrences of domestic violence, substance abuse, and mental health issues. We know in California that only 1 in 9 children with an allegation of abuse are actually substantiated. That's that 11% substantiation rate. The highest number of reporters are coming from education. So teachers are seeing kids every day in the schools. They want to help. Many of the people that I shared their quotes of mandated reporters, those were educators. And they're calling for help. And the system is substantiating 4% of those cases because they're not actually seeing that there is it rises to the level of abuse or neglect. But the teachers are wanting support. They're wanting to connect families. And so there's this over-reporting as well as this under-reporting that's going on. For counselors and therapists, we're the 3rd highest reporters, and only 5% of our reports are being substantiated. We also know that there is significant disproportionality. I see some shocked faces in the room. Black and African American, Native American, and Latino families are significantly more reported to child abuse hotlines around our country. These are numbers from California. 1/3 of all children are reported will have an investigation of child abuse before their time is up, before they age 18. But 50% of Black and Native American children in California are subjected to an investigation by the time they are 18. So the system is not working, certainly not working for all families. And so this is what has driven these recommendations from this task force. There's a lot on these slides. I'm going to pull up the highlights. These slides are available for you. But there were recommendations to focus and sustain action to ensure that there's fidelity and accountability. So significant review of data and holding the system and ourselves accountable. There's also policy recommendations. We need to change laws. We need to change regulations that will address this well-documented over-reporting in the current mandated reporter system with a focus on disproportionate burden on Black, African American, and Native American communities. And so you can see these 4 policy levers of change. There's also significant training opportunities. We want to leverage training as a tool to shift the conversation and move from mandated reporting to community supporting. And how do we do that as a whole state, as a whole system, at every level? And then finally, it's the development of a community pathway, because how do we create and understand what the resources are that need to be available for families in order to make connections for families and communities? And then we need this narrative change. How do we change, not just increase awareness and understanding of the need for mandated reporting reform, but how do we change norms, attitudes, and beliefs around who is a family? How do we support them? What is our role? So these are the 5 different areas that the policy folks have recommended at a state level, and significant work will continue. A task force is being continued to implement. We're now moving to implementation of these recommendations to really implement and what is the next step. And we know that each one of these needs to move forward. But there's opportunities to engage. And if you're interested, I have my email that, and if you're interested, I'd love you to participate and really get involved. There's some incredible work that's happening in Los Angeles as one example of how a county is taking this work forward that I wanted to share. The Los Angeles Board of Supervisors passed a resolution, Supervisor Horvath, from moving from mandated reporting to mandated supporting. One of the things that they created was a decision tool. It's a very user-friendly decision tool on how to make mandated reporter decisions in a clear, unbiased, and potentially peer-supported way if you want supports. Basically pauses you to think, should this family be reported? Or are you bringing in your own biases into this? Is there another way to help a family? Remember, this is about neglect cases. In a situation of physical abuse or sexual abuse or emotional abuse, those are cases to be reported. And these are a way to pause and think about, are there other resources available? UCLA helped the county in LA to develop this wonderful, very user-friendly training. Sometimes trainings are not always user-friendly. This one is. And it also has a training for those in education, as well as those for plans of safe care. So I'll give you the link for this if you want to learn more, particularly about AB 2085, because this legislation is for the whole state. This was developed in Los Angeles, but it applies to the whole state. LA has also created this wonderful family resource guide of how to find supportive services. I can imagine many of you are working with families and you want other help. And how do you get other help, particularly in the time that you have with a family? LA has created this wonderful tool. Dr. Shannon Tyne, who many of you know, used to work at SF General, was instrumental in creating this tool in Los Angeles and really helping families connect with resources. San Francisco and Bay Area counties have the ability to create this same kind of tool, but I show it as an example. And so now we are in the place of thinking about, we've reformed mandated reporting, but we need to build this community pathway. And so this work is ongoing. It's frankly what I am most passionate about, is thinking about how do we serve families in community? What does that look like? Dr. Lieberman is an expert in this area of connecting and supporting families and creating these partnerships. But how do we think about supporting families and all their social determinants of health through community connections to ensure that they're accessing childcare and education and medical care and housing right from the start before a crisis happens? How do we build that? That's voluntary. The court's not ordering somebody to go to services, but it's voluntary, it's trauma informed, and it's culturally relevant. And we're promoting resiliency. Let's create that pathway for families. And how do we ensure that families and caregivers can access the services well before Child Protective Services may be involved? It's not attached to federal funding. Services can come and families can decide if they want to have that service. And CPS isn't tracking them if they decide to enter, but also not tracking them if they decide this isn't the right time for me to get services. They're not penalized for that. This is the pathway that we need to create for families. There's many steps that we need to do to operationalize this pathway. We need to think about how do we include those with lived experience at the table to make sure we're developing policy right from the start that empowers and lifts up voices. How do we think about connecting families and caregivers to access services? Now, this gets really sort of technical and wonky, but let's do more warm lines. Safe and Sound runs the 24/7 talk line. There are other warm lines within our community serving different populations. How do we create warm lines so families have an immediate place to call before a crisis happens? Family resource centers, home visiting programs, and really create this community referral system. We're in conversation with Dr. Quo at the UCSF Children and Families Department and SF General, and to create this referral system that when she sees a challenge, she'll call a community organization. Kaiser is doing the same thing, and vice versa, because community organizations can't support the acuity of families. We need this interconnection with UCSF and others who are providing incredible services and supports and academic research. So I also really think there are opportunities to explore increased partnerships with research and academic institutions that would include referrals. Think about research and policy developments. Where do we need to take this place going forward? UCSF has such an incredible reputation in the field of change. How do we leverage? How do we partner together to do this work? How do we build capacity? How do we think about internship placements? And also fund developments. Let's partner together on resources and gathering resources. We also need to invest in community infrastructure. There's a lot that is an investment in programs and service delivery, but we also need to invest in small and medium-sized organizations that may not have the ability to to do a blended funding stream, to have all the services that are needed? How do we think about these backbone organizations and building networks? And finally, how do we change norms, attitudes, and beliefs with narrative change? So I talked about a lot. I wanted to bring us back to this ecological model and think about what all the change is. And I wanted to also quote Dr. Hinshaw, who in writing about his field was profound, his field of psychopathology and reducing the stigma and discrimination. He said this quote that I think is so profound for so much of our work, no matter what the field is. Accumulation of individual level actions can precipitate more general societal change, and supportive contexts and policies pave the way for individual and family thriving. Right? This interconnection between what's happening at the individual level and the contextual level, the larger government and systems level, and vice versa. How do these multi-systems work together? So in closing, I think there's opportunities to promote protective factors, increase economic and concrete supports, expand family strengthening, fund prevention, fund this pathway to prevention, and really change narratives and shifting beliefs. I hope you get involved and learn more. And I have a list of resources for you. I'm open to answering any questions. Here's my website. I thank you. Here's my email. I thank you so much for your incredible energy and for inviting me here today. Thank you.
This was amazing. You gave us a lot to think about, and we're going to open it up to questions. I have one question. Since I have the mic, I'm going to go ahead and take this opportunity to ask, given the San Francisco is heading into close to $1 billion deficit, and a lot of our contracts are going to be cut in significant ways, Medi-Cal contracts, because of this deficit. And so my question to you is, what are some tips, tricks, guidance, some wisdom around getting funded for these kinds of efforts, especially in the context of a greater national effort to ignore and dismantle many of the public health services that we have serving the children and youth and families that we serve?
What a wonderful question. Thank you very much for it. I think the context both at the local and the federal level is profound. I think there's a couple things very tactically that we can do in San Francisco, which is to continue thinking about revenue maximization. One of the efforts that we started at Family Resource Center level, it actually drew out of work at UCSF through the California Children's Trust, was thinking about county administrative activities, CMA funding through Medi-Cal. I use that as an example of how do we create public-private partnerships to think about revenue maximization and draw down both more state and federal funding. It's something that San Francisco has deep expertise in, but sometimes we don't flex that muscle because we have had the benefit of a robust general fund. And we saw during COVID that we didn't have that as much. And so we came together and partnered substantially to create increased revenues. And I think that there are lots of partners outside of San Francisco that we can look to for good examples and advice. Other counties that are doing blended funding very well that we can learn from. So that would be my tactical suggestion around how do we think about funding structures. It's not going to solve all problems, and these are long-term goals. I think the other is advocacy, deep advocacy about thinking differently about children and families. We talked a little bit, the question raised what's happening at the federal level. What's interesting about these changes is that they are bipartisan. The work around mandated reporting in particular is happening in many states, no matter what their political votes, if you are red or blue in those states as the governor. Texas is actually doing some of the most profound family strengthening work with significant investment in family resource centers, as well as moving very far on mandated reporting. And I think those kinds of partnerships are really important. You may ask why. Some of that is because people want government out of their families. And a lot of this effort is about how do we right size and support the children that need support within foster care setting, and how do we support families outside of a government system, and really build communities. And so I would look at those unlikely alliances as well to support children and families. And I think there are many opportunities throughout the country around that. So those are just a couple ideas as you think about the next 4-8 decade of time.
Thank you so much for your incredible work and the beautiful presentation to help catch everyone up to the decades of background that is necessary to understand the current landscape. I'm going to shift from direct practice, direct funding issues. Several folks in our department are researchers, and it would be helpful to hear from you. I remember the slide with Mark Ghali, and it was like number 14 something, but it was around how do we shift the zeitgeist, how do we shift the community understanding, public knowledge and understanding around the need to prevent, the need, something along that space. And I'm wondering, are there conversations, are there buckets of need that you wish researchers would tackle and provide some evidence within that would really expand your capacity to enact some of these things or get people to fund some of these things? I mean, there's a lot of people saying, oh, trauma's bad. We know it's bad. Like, there's a lot of data on that. Do you need more of that? What else do you need?
Thank you so much for that question. I really appreciate it, Dr. Bush. Yes, we do. We need to create this stronger partnership of research. And you saw when the paradigms shifted, it's because they were led by research, right? Brain science and ACEs really led these dynamic changes in how we think about children and families. And researchers bring this unbelievable validity and credibility to the work. I'll just, by way of background, we started this work around the economic analysis of child abuse. And I can tell you, if Safe and Sound issued that, no one would have read it or believed it. And the numbers are large. And we intentionally partnered with UC Berkeley, not just because they're smart and thoughtful and great and amazing partners, but because their name was so important to validating the work. And so thank you for offering opportunity to partner, because UCSF brings that necessary expertise and validation to the work. I think there's a couple areas specifically to partner on with respect to the mandated reporting, community supporting work. One of the things that we know have a lot of research at that individual level. We don't have enough research at that community level of what are the systems that are working, and we don't have enough research around the systems level. Even just understanding what the changes of AB 2085 and the definition of neglect, what is the impact of that going to be on the safety of children and families, that area is open wide for lots and lots of research. I also think in the development of the community pathway and how to think about doing it right, we're going to need a lot of research in that space as well. So those are just a couple of examples. And I would love to have a separate conversation with you. I think there's an opportunity to bring a think tank together, so to speak, small working group, to think about what are some of the research opportunities and how lots of legislation is going to be needed in this space. What do the legislators need in order for the legislation? For example, the Legislative Analyst Office has done significant work in the area of disproportionality and published that research, and they're going to take it to the next step. What are some of the research components that they need in order to take it to the next step? That's where I would focus on.
Getting to you, Dr.
Hi, thank you so much for this talk. Many of us are clinical educators, and something I consistently hear from learners is this fear about mandated reporting and wanting to make sure that they're doing the right thing by the letter of the law, but also by their families, and feeling that tension. I really liked your resources about the decision tree. We always used to say, oh, call and you do an anonymous call and they'll guide you. And I've been hearing a lot from my learners and colleagues that this has been a less successful effort recently, where the people on the other line said, we can't really do that. And so I'm wondering if you have any other suggestions for folks who are grappling in the moment with, is this a mandated report or not, and resources or tools or language pearls that we might be able to offer.
Yeah, and this is the fundamental challenge and tension, what you just described, because there are children that are not safe, that need the support, and there needs to be an investigation done. And what's happening is they're not getting through because Child Protective Services is handling the 89% of these cases are unsubstantiated. And so we need to, again, like right size the system so the right matters are coming to the attention of Child Protective Services, and they can provide what they are so good at, is safety and support for families, and community can provide the support if it's a case of poverty, or another government entity. It doesn't have to be child welfare. You have First Five, Department of Children, Youth and Families. There are many resources, Human Service Agency, Department of Public Health, that can provide support for families. And how do we differentiate what those are? As a practical matter, that's a systems question. As a practical matter, I really encourage you to look at this decision tool that has been created in Los Angeles. It's very effective to help you go through the decision process of whether or not to make a report and who to call if you decide not to make a report and where to go. The challenge in San Francisco and in other communities is the rest of the infrastructure hasn't been created yet. Even in Los Angeles, it hasn't been created yet. And so that work is done in partnership with child welfare in Los Angeles. So they have the language, and we're catching up. Our child welfare department, Joan Miller, is phenomenal, and she is on the cutting edge of this. And so we are, thinking about what that protocol might look like. But there is a tension, there is a disconnect. But that's where I would start at an individual level. And I would reach out to all your partners and say, we need to do more. And how do we change the system within our county? How do we create these resource guides? How do we partner with child welfare to make these changes that are so needed? Because our families need it. So that's where this multi-system or multi-level approach, we can take this action at an individual family level, but we really need to think about the community and systems and context level to make needed change for families long-term and holistically.
Is there a question up there? There is a request on our from our online community. If you could go to your resource page that you had on your slides, just so folks can see it one more time. Thank you. Any other questions that have come up? I think this is thank you.
I will say, I don't know if there's a possibility. All of my resources are linked with hyperlinks, and there's hyperlinks within the PowerPoint as well for all the sources. So I'm happy to share that so that you can go on the research and do your own independent review.
It's interesting thinking about the level of the burden on the system. And this is probably a minor kind of section of the pie of reports. But I know that some of us make reports at the request of parents. And then, they're sort of lower level, like, when there's, lower level. There's child sexual abuse, but the person does not actually currently have access to the child. So that you're filing a report, that they probably won't follow it up, but this is somebody who might get custody later on. Or there's like, I sometimes work in cases with murders, and then we want to actually stack up the reports so that somebody can't have access. Is there a more efficient way to do this? Because that's been the bulk of my reporting, has actually been at the request of families in order to keep the child safe in the future, even though there's no imminent risk. And I'm guessing this is a smaller section of the pie, but if you were looking to reduce burden on the system, that would be one.
That's an interesting question. I think I go back. I'm not going to be able to find the slide so quickly. It is a smaller group. Let me just go back. Doesn't mean that we shouldn't focus on it. In fact, it's critical that we do focus on all of it. If I understood your question correctly, we might be talking about some of the sexual abuse cases that are on here. And for those on the phone, it's not just the sexual abuse cases, but the domestic violence cases. I don't have I wish I had an answer. I don't have a good answer. I actually think that the most complicated and critical and urgent area that we need to focus on is domestic violence. There are so many complexities. And what I would only hope for us is that we can think about how to reprioritize so that those that are really experiencing, families that are experiencing poverty are supported by the systems that can best help them and not removing children from the home. So that we as a system can understand and support the families that you're talking about in a more holistic way over the long term. There are the mandated reporter, community supporter task force had many domestic violence advocates at the table helping to think through what the solutions would be. But I wish I had a better answer for you, but I don't. I think it's going to take smart policy, those with lived experiences being at the policy table, and a significant opening up of what are the prevention opportunities to help families. Going to the question preceding yours, this may be one of the most impactful ways of thinking about research opportunities of what actually works in this space, because it's critical. So thanks for the question. I wish I had a better answer for you.
Well, your talk was brilliant anyway.
Usually does.
You are brilliant.
Okay.
We have to end today. It is past 1 o'clock. It has been wonderful experience. And I'm glad that we have a chance to talk with you a little bit later this afternoon. So take care, everyone.
Thank you so much.